Hello, I'm Maria Hall Brown, and this is LA Currents. The coronavirus, COVID-19, brought with it a trifecta of bad news for health, for finances, and now, as it turns out, for mental health as well. I'm delighted to welcome Joanne O'Brien and Dr. Kokinda from LA City Medical Services. Dr. Kokinda, as a species, how are we at adapting to such stressful and dramatic changes in our lives?
You know, humans are actually quite resilient and quite adaptable, which is the good news. Lots of things that psychologists are recommending now is, first of all, keep your routine to some degree. It's going to look very different. That's something we all have to accept, but try to keep a routine. If you're working from home, try to get out of your PJs, get into some sort of work frame of mind.
And we don't mean your daytime PJs from
Right.
your nighttime. We actually mean actual get dressed.
At least to some degree, yes.
I love that whole idea of not being perfect. I think all of us are, obviously not necessarily understanding what's going on, or if we do understand what's going on, not understanding where it's going to go, and then feeling as if we have to be brave and bold and strong and a teacher and a mom and a worker, and if you're working remotely, but you can give yourself a little bit of a permission slip during this time to not be that perfect person.
You can always give yourself that permission slip within reason, but now especially, it's not about winning the pandemic. It's about getting through the pandemic, keeping everyone safe, healthy, balanced. That's what you're looking to do.
There are some good things. I see more families together outside walking, where you didn't see that before. Enjoy the moment of being together with your family because we're always so busy usually.
This seems to be a really good time for people to pick up new pastimes and new skills. I know that that's one of the things that a lot of people have decided to do in order to make this time valuable personally. You made banana bread.
I did. I'm on the list of the million other people apparently who've been making banana bread lately. But that goes back to the coping skills. You want to keep yourself busy. It distracts from the negative thinking, the worry, the stuff that's not productive.
So being quarantined at home has caused some issues for people. And what are some of the things that you have heard of or seen when people have been living in this new reality?
Conflictual relationships have had some fuel to the fire.
There are resources in LA City for people who have found themselves in an untenable situation because of those that they are quarantined with. I mean, I know we had mentioned something about spousal abuse and terrible things like that. But there are places for people to go. You're not trapped.
Right, there are safe shelters. I know the Los Angeles Police Department is ready to respond. They want to know about this. There's safe shelters. There are numbers available. So I think Chief Moore's message is you don't have to stay there. You're not alone, and there's help.
Well, that's really nice to know, because I think that there's also that issue of we don't have any choices right now. We don't have any power. We don't have any ability to make any decisions. For someone who normally doesn't think of themselves as having any kind of real mental health issues, what are the triggers or what are the signs that if you're having at home, you should realize, wait, maybe I need to take this a step further and get some assistance?
It's the things we mentioned, the trouble sleeping, irritability, detachment, low mood, or the inability to turn off those excessive worries. It's not a little bit of that. It's, okay, this has gone on for a few days in a row. It's continuing to go on. Usually when it reaches about a week of these concerns, it's definitely time to reach out. It's good to be proactive and get some support or resources as soon as you notice you're not able to use your usual coping tools and get yourself out of the rut that you're feeling.
They talk about the stages of grief. Are there actual stages that we can sort of take a look at and see that these, because I know that you had worked in an arena in which people were incarcerated, prior to your work with the city. So are there stages that people go through that you can almost oddly predict given what's going on now?
Definitely. The stages of grief, it's not just the loss of a person, which unfortunately some people are experiencing now, but the loss of other things. Everyone's life, no matter who you are, has been turned upside down, and it's been that way for long enough now where the initial shock of the situation is wearing off and people are going through these stages. Adults, children, I was just reading some literature on teenagers having a very hard time right now because their social life has been completely changed and limited, and they struggle with coping with those emotions. But if you look at the stages of grief, you can apply a lot of that to the situation.
So the whole idea of masks came a little bit late versus the very beginning of what we began to learn about COVID-19. So why masks now? What is it about masks?
The virus, as we've learned, is spread through droplets. It's an aerosol. So those, when you're normally speaking, those will just come out. The cloth covering just simply keeps that spray in.
You see people wearing them in a car, and you're thinking, why? Why do they have that on in their car and they're by themselves in their car?
They may have had someone in their car so that they're protecting themselves or that person. There might be a story there you don't know about, or it's just that person's comfort level, which is okay. However, it's going to help that person get through all of these changes in the pandemic.
I know one of the fragile groups, obviously, are seniors, and this has got to be really tough for them because not only is there a health crisis, but there's also that sense of isolation because now they can't have the visits that they would have from family members or have the experience of socializing in a restaurant setting or something like that. So what are some of the things that we can do to help those fragile communities such as seniors?
Definitely reach out. If you can, give them a FaceTime chat or video chat. Let them see your face. If you can safely drop off a care package or something, that's something people have been doing also. And keep in mind, seniors are a population that's lived through a lot of different adverse things in the past, so they probably have a lot to offer you as well if you have some conversations about how to be resilient and get through tough times.
That's actually, I hadn't thought about that because, so many of our parents and our grandparents have lived through nothing like this, however, but they have lived through really tough times. So they could be a really good source of advice with all of us trying to manage this.
Definitely.
Yeah. So now we're going to get back into the workplace, maybe slowly, and that obviously means there have to be some very conscientious choices made there.
When it's safe, people will be returning to the work, but how we work might be different. For example, you have a construction worker who maybe would share tools. That's not a good idea anymore. Things like that. When they're up in a building building something, they'll have to be apart 6 feet. So I think our world will look different. We'll probably have a lot more Zoom meetings. I don't know when we'll be ready to have 20, 30 people in a room for a meeting. So I think our world, we can go back to work, but how we do that is going to look different.
And
for
how
a
can
while.
we prep for that psychologically? Because there are going to be people who are going to jump right back in because they're social creatures and they miss humanity. There are going to be other people who are going to be terrified that they are going to get sick or bring that sickness home. Or, the scope and scale is going to vary. So what should we internally be doing to sort of work our way back into, because we've all changed, whether I scrub things down forever is a big question mark in my life. What's going to happen? How do we figure that part out? How do we be sensitive to what's happening internally and those around us?
I think one thing goes back to be careful judging others and their situations you may not know or internal processes someone else might be going through you're not aware of. But also be mindful that you're going to have to stay in the moment. We want to practice mindfulness. Don't get too far ahead because we don't really know what's going to happen. It's a lot of unknowns, and that's hard to cope with for any of us.
So when all this is past and we look back, how has Los Angeles done?
I'm completely impressed on how Los Angeles has handled it. I think everybody really worked together. Everybody did what they were supposed to do. And you can see it by the numbers. Mm-hmm. So if you just watch those and if you're data driven, but it's been pretty impressive of how the whole community has come together and helped each other. I think that's what's been amazing.